from the American Academy of Pediatrics.
The number of children with prediabetes and diabetes in this country is unfortunately and undeniably on the rise. There's lots we need to do to reverse this trend, starting with open and empowering conversations about it. Once again, I have just the person to answer all our questions.
There are a lot of things that parents can do to help reduce their child's risk for type 2 diabetes. Things like exercise, 30 minutes, 5 times a week, going for walks as a family, increasing fruits and vegetables in their diet, switching from juice and sodas to water to drink, many different things that can be done to reduce the risk for type 2 diabetes.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I'm a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions and the answers will hopefully be even better. Let's get started. Today, I have with me Dr. Brittany Bruggeman, who is a pediatric endocrinologist and diabetes expert at the University of Florida. Brittany, welcome.
Thank you so much. I'm excited to be here.
And we're excited to have you. And I wanted to start with a big picture question. How big of a problem is diabetes in kids right now? And how has that changed over the past few decades?
Well, I think that any diabetes in kids is a big problem. I've actually spent my career so far trying to eliminate diabetes in kids, and I don't want any child to have to deal with this problem. So I think it is a substantial problem in the U.S. About 1 in 300 kids has some form of diabetes. And it is increasing over time. Both type 1 and type 2 diabetes are going up in the United States.
Yeah, and because you mentioned type 1 and type 2, Brittany, what is the difference between type 1 and type 2 diabetes? And then I wonder if you can tell us about the causes and risk factors and how they differ.
Diabetes can be a tricky thing to understand. So I'd like to try to break it down for parents because it's something that I didn't know much about until I went to medical school. And so type 1 and type 2 diabetes are both a problem with insulin. And insulin is a hormone. So as a pediatric endocrinologist, my job is to help improve people's hormone status. And insulin is one of those. And a hormone is really just a message that the body is sending to itself. So I kind of like to think of hormones as, text messages or emails from one part of the body to another to tell it to do something. So insulin is a hormone that is made by the beta cells in the pancreas, which is an organ in your belly, and it goes to different parts of the body through the bloodstream. And in type 1 diabetes, we don't make enough insulin. And in type 2 diabetes, the insulin message just isn't getting through.
And what about the causes and the risk factors? Because I do think in addition to, of course, type 1, where you don't really make enough insulin, and type 2, where the insulin message isn't being heard, there are differences in the causes and risk factors. And I wonder if you can walk us through that.
Yes. In type 1 diabetes, an autoimmune attack is happening on the cells that make insulin. And autoimmune is when the body's immune system, which usually fights off bacteria and viruses, is accidentally fighting something that it's not supposed to be fighting. So in type 1, it's fighting off, they're called beta cells, and they're the factories for making insulin. And, the risk factors are basically having genes that put you at risk. Not everyone with the risk genes for type 1 diabetes gets type 1 diabetes, but that is a risk factor. And then something in the environment will trigger your immune system to accidentally attack these cells. In type 2 diabetes, you also have genetic risk. So families with type 2 diabetes tend to pass down risk genes for getting type 2, but there are triggers in the environment as well. And usually that is having excess fat deposited in the organ that makes insulin, so in the pancreas, and then in the liver. And so some of that can be related to obesity and also related to diet and activity.
Absolutely. And I think it's important to mention that the majority of kids have type 1 diabetes, which is always treated with insulin. But there are other medications that can be used for treating type 2 diabetes. And then I wonder, focusing a little bit more on type 2 because it feels, and you tell me if I'm wrong, but it feels like the one that we have a tiny bit more control over, right? So what do we know about how it starts in childhood and the origins of it? So type 2 specifically, even if, of course, the majority of times it doesn't show up until later in life.
Yes. So the origins of type 2 diabetes, as I mentioned, are multifactorial. So that means that there's different factors that go into it. And it's a combination of genetic risk and then lifestyle. So, what we eat, what we drink, our exposures throughout our life, and exercise. And so, things that can improve your risk for type 2 diabetes would be things that reduce fat deposits in the liver and the pancreas. And so that would be having a good, healthy balance of exercise, eating healthy foods, and maintaining a healthy weight.
In your experience, Brittany, because I think sometimes we sort of counsel, we say like, exercise, eat a healthy diet, get enough sleep. Do these things actually make a difference in whether a child who is at risk of type 2 diabetes because of their genetic factors later develops type 2 diabetes? Like, does it actually make a difference?
100%. So having healthy lifestyle behaviors like eating healthy foods, exercising makes a huge difference. And we see that because, when we do things like weight loss surgery, where people lose a significant portion of their body fat, you can actually reverse type 2 diabetes by losing weight. Now, I don't want to put all of the blame on lifestyle because like I tell parents, you just got the genes, unfortunately, that make you more at risk for type 2 diabetes. And so you can have one person who does have an unhealthy weight. So for example, unhealthy weight kind of runs in my family, and a lot of my family has a high BMI or obesity, but type 2 diabetes really doesn't run in my family. And so, some people in my family may have a high weight, but they don't get type 2 as easily. Whereas in other families, you may have a little bit of overweight and you do get type 2 diabetes. And so you just, got those cards. Those are the genes that you were dealt. And the good thing about it is that anyone benefits from having healthy lifestyle changes. So even though my family doesn't have a high risk for type 2 diabetes, improving our lifestyle, like having a healthy diet, having exercise, does improve risk factors for other things that may be, risk factors for our family. So anybody and everybody should be focusing on these healthy lifestyle behaviors. And people who are at risk for type 2 diabetes, it's especially important for them to focus on it.
Yeah. And I wonder, Brittany, as someone who very clearly talks to families about this on the regular, how are you making sure that you don't stigmatize weight as you discuss risk factors and lifestyle modifications and all of the things that go with it?
It's really tricky. I'm not going to lie. It's very tricky. And it's something that I've had to develop over time. And everyone makes mistakes. So, if people have made a mistake in talking to families, it's important to not cast shame and blame on yourself, but just trying to do better. There are a lot of things that parents can do to help reduce their child's risk for type 2 diabetes. Things like exercise, 30 minutes, 5 times a week, going for walks as a family, increasing fruits and vegetables in their diet, switching from juice and sodas to water to drink, many different things that can be done to reduce the risk for type 2 diabetes. So I think when you focus on the lifestyle behaviors in reference to health, it can help destigmatize it. I want to emphasize that healthy lifestyle behaviors are good for everyone to do. So it's important that we're counseling everyone to have improved exercise and improved, eating fruits and vegetables and getting enough sleep. And this will really decrease the risk for type 2 diabetes.
Yeah, I love that. And it really is about health at the end of the day. I got to tell you, I'm a little extra in my practice, especially especially when I'm talking to girls, but I know that I have to be conscious about it when I talk to boys as well. But I really go out of my way to be like, you are gorgeous, you are beautiful, let's talk about your health, because I really, really don't want to perpetuate that stigma that is so ingrained in our society about weight. Speaking of things that happen at the pediatrician's office, at what age can parents expect their pediatrician to start screening their children for diabetes risk? And talk a little bit about who may be screened earlier.
Yes. So for type 2 diabetes risk, type 2 really doesn't tend to happen in kids until adolescence. When kids hit puberty, that's really when the risk for type 2 starts. And so pediatricians may consider screening for type 2 diabetes at around age 10 or above if there are other risk factors present. For type 1 diabetes, the American Diabetes Association recommends screening family members of people with type 1 diabetes.
Yeah, perfect. And of course, we're always looking at children holistically, right? We're always looking at how they're growing in height and weight and how they're doing and everything else in their lives, right? So it's part of the bigger picture, just to say. Now, Brittany, what are some early signs of diabetes that parents should never ignore?
This is such an important question because I always want parents to be able to be an advocate for their kids and to know when something isn't right. So for diabetes, the most common symptom is going to be excessive thirst and urinating a lot. So having to go to the bathroom many more times a day than you would expect. And this happens because when insulin isn't working the way it should work, there's nowhere for glucose, which is a fancy word for blood sugar. There's nowhere for that blood sugar to go except for out into the urine. And it pulls water along with it and makes you just have to pee a whole lot. And so kids may be asking to go to the bathroom every hour to 2 hours. They may get up multiple times in the night to have to go pee. And they may start wetting the bed where they were potty trained before. And those are all concerning signs. It doesn't mean you have diabetes, but it's just little red flag warnings where maybe you should get checked out for it. And so if your child is very thirsty, peeing a lot, later on, symptoms can include belly pain, nausea, vomiting even. And once we get to the stage of vomiting or being really, really lethargic, that's an emergency sign for diabetes. So I like to tell parents, if your child has symptoms of the flu, like nausea, vomiting, breathing abnormally, and they're also peeing normal or peeing more than you would expect, those are red flag warning signs, and you need to be seen right away.
Yeah, those are you gotta go signs, not something you can wait on, definitely. Now, stepping back for a moment to sort of talk about the larger picture of diabetes and risk in our communities, I do have to ask you, how does access to food, the neighborhood in which a child grows up, and even race factor into diabetes risk, Brittany?
These are all really important questions too, because there are things that we can do as a society to improve our overall risk for diabetes. And improving active play spaces, so having access to playgrounds, having access to safe places to walk and run and bike, do improve risk for diabetes. And the same thing goes for food. So having access to healthy foods in your neighborhood, having access to a grocery store or a farmer's market also is really important for being able to do the things that the pediatrician says to do. So when we tell our patients to go eat healthy food, they need to be able to access that food in order to do so.
Yeah, and if we want to reduce the risk of diabetes at large, right, at a population level, then we have to invest in prioritizing those things, which I know you do a lot of work to advocate for. So definitely that is where we're going to get our bang for our buck. Now, Brittany, as we come to the end of our show, we like to end every episode with what we call a parenting prescription. So when it comes to preventing diabetes starting early in life, what do you want all parents to remember?
There are some really great things that parents can do to help their kids to have a healthy, long, fulfilling life. I feel like a big part of my job is empowering my patients to do the things that will improve their health outcomes so then they can go do the things that they're meant to do in life, to go fulfill their dreams and get a job that they enjoy and just do all the things that we want our kids to grow up and be able to do. So it starts small and it starts at home, and it's sometimes little changes. So I like to talk to parents. It's called motivational interviewing, but asking them what will work for their life and trying to see how we can get there with some of these lifestyle changes. So even switching from juice to water, or doing, little things to increase fruits and vegetables in their diet, going on walks together as a family, just things like that seem small, but when you do them for years and years, they make a huge impact on the risk for diabetes. And then when it comes to type 1 diabetes, I like to tell parents just to be aware of their family history, kind of know, is there autoimmune disease in my family? Do my relatives have type 1 diabetes? And should I think about having my child screened? Because we actually can do a screening test in the blood to catch things early. And so if you have those types of things in your family, going and talking to your pediatrician about potential screening would be something to think about.
I love it. It's all about having the knowledge and going slow and steady on changes that you can sustain so that you prioritize your long-term health. Thank you so much, Dr. Brittany Bruggeman, for joining us today. This was lovely.
Thank you so much. I had a great time.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega, Susan Stevens-Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.